Now we're going to move over to our friend, Dr. McInnes at Osmind, to tell us some more about how in a psychedelic medicine practice we can get our electronic medical records to be on our side as well.
Thank you, Lynn Marie. Okay, so I'm going to talk about 5 key features for evolving psychedelic practices. And the word evolving is critical because this is all under development. So who am I? I'm Vice President of Scientific Affairs at Osmind. I have a long background in research. I was formerly an associate professor at Mount Sinai, studying the genetics of behavioral disorders. It was there that the seminal work in ketamine therapy was begun with Dennis Charney and Sanjay Matthew. I kept my eye on that and then went on to found and direct Kaiser Permanente's ketamine therapy program, which is still going to this day in Northern California. I'm also a member of the American College of Neuropsychopharmacology, and I've authored 2 papers on ketamine infusion therapy outcomes in very large sample sizes. Next, please. Okay, so I believe we actually are the only full stack EHR built by and for mental health clinicians for psychedelic treatment practices. And really our technology platform is meant for anyone who is treating moderate to severely ill patients, whether it be with interventional psychiatry, medication management, or psychedelic medicine. Next, please. Okay, so here's some 5 top features. So customizability. So we just talked about how the codes are evolving. Well, guess what? We're going to be having a lot of non-standard operating procedures, a dizzying number, as for example, as MDMA rolls out. And there's going to be a need to be flexible. Consents will have to be modified as we go, and custom notes. I'm going to go on more about that in a moment. Automated REMS programs, risk evaluation and mitigation strategies are going to be the order of the day. Every new medicine, every new psychedelic medicine is going to have one. Patient engagement via app for ease of delivering measurement-based care, so surveys, outcome surveys, and also a journaling feature that can be shared with your provider so that you can look at. People forget a lot of times what happened after a psychedelic experience. If they can write it down right afterwards, it's very useful to share later. And then it's very useful that mental health clinicians are involved in designing the EHR because we actually know what's important to include. Next, please. Okay, so customizability. So I'll tell you that I'm working with a team of lawyers who are involved with, very integrated with MAPS in terms of trying to figure out how we're going to roll out MDMA. And many ketamine practices I know want to sort of participate in this, and they're the ones they told me this joke. You can hear the episode if you want on our Psychiatry Tomorrow podcast. But anyway, they said, well, instead of the physician-patient relationship, it's now the physician-patient-lawyer relationship. And that, documentation is your first line of defense against malpractice. It keeps both you and the patient safe. So we don't want any more paper. That's a non-starter. So we want everything to be completely electronic. And so we want to be able to customize as you go. So we offer a standard intake form that auto-populates into the patient chart. So when the patient fills it out, you don't have to copy that out again or cut and paste. It just goes right into the patient's chart. And then you can create your own forms, of course, and the same thing happens. And then you can, on your end, the clinician end, you can edit it for accuracy. So you don't want a lot of history coming at you in PDFs and having to search around in unlabeled PDFs. You want everything to be sort of like this constantly updated living intake form. Okay, next, please. Okay, so right now we have ketamine therapy. That's where we haven't gotten to the other psychedelics yet. So let's use ketamine therapy as an example. So here you want to really be able to document the time of dosing, the number of doses, the method of administration, whether it's IM, IV, whether it's lozenges, intranasal, whatever you like, as well as height and weight, BMI, vital signs, and really importantly, ability to document additional medications administered. So, if you give, for example, Zofran for nausea, you want to be able to document that right there in the note. Okay, and something else that's important to mention. This would be an administration note here, but you want to also show that you completed like a review of systems that was specific to the medication, right? So ketamine, you want to make sure that you documented that the person's blood pressure is under control. Any of the potential comorbid medical conditions that would be contraindicated for ketamine or medications, you want to have made sure that you address that with a specific template in the chart. I'll also point out that we have a caretaker integration, and basically you can use a QR code to upload continuous vital signs into the electronic health record. Okay, next, please. All right, so we have automated the SPRAVATO REMS program into our EHR, and we'd like to think of this as basically the dress rehearsal for the rest of psychedelic medicine, because normally you'd be filling out these REMS forms on paper and shuffling around and faxing them in, and maybe they'd be illegible sometimes, and then they have to be sent back to you, and so by having it integrated into the EHR, you can make sure that everything is actually correct before you send it. It follows the workflow that you're going to need. You need to all the things that you need to do to document safe administration of medication, and then you hit a button and it goes off to the central office where it goes. Okay, so this is the kind of thing that is going to be crucial for to make your life easier when MDMA comes out as well. Okay, next, please. All right, so patient engagement, of course you want to be able to, this is all HIPAA compliant, and of course you want to be able to engage the patient around billing and scheduling and claims. But you also want to be able to send your measurement-based care. And then there's the journaling feature. Now, natural language processing is ubiquitous now. It's all over. Every time we use a search engine, we're using natural language processing. And very soon it'll be, you'll be able to do your own kind of natural language processing on these types of notes, right? And there's programs right now that offer this, like combined sort of a note taking and natural language processing. So all of these things can be really, really valuable. In addition, for the patient engagement, we have a patient community, and where patients can receive advice from each other. Okay, next, please. So measurement-based care, this is really key. If you're not measuring it, you have to measure it. Many payers are going to insist upon seeing that patients are actually doing better in order to sustain the treatment. And so here we have an example of a PHQ-9. The patient you can schedule it to send it out however frequently you want. And so then the result is graphed in front of you there. And those lines represent ketamine treatments or whatever kind of treatment, could be MDMA. So you can see the relationship for yourself of the treatment and the mood scores that result. So there's we have over 40 surveys now, all different types, and we'll be adding more in that will speak to the psychedelic experience. Like, for example, we have the MEQ, but I think the emotional breakthrough index is one that's going to come up soon, and others like that. Okay, next, please. All right, so this is kind of the grand finale overview. So we've got the EHR, the patient app, sort of the billing, scheduling, and claims. Something that I didn't mention was the provider community. And I think, Lynn-Marie, you are creating this wonderful provider community, a place where people can ask questions and receive education. And that's really, really important. This kind of community is really useful if you're using a product and you want to ask other people, hey, what are you doing? How are you making this work? This isn't working for me. Or if you want to be able to if you're saying, oh, I'm setting up my clinic, and does anybody have an SOP for this aspect of MDMA? Or, I had this experience, this type of thing, right? You can share forms, share knowledge. I provide, research, the cutting edge research developments in there as well. And then another feature is analytics. So you kind of want to know how well are my patients doing overall. You know, since I started MDMA, what do all the MDMA patients look like, right? So you have this view where you can see, oh yeah, okay, so this is the outcomes for all these patients together. And you can also look at, hey, what is the health of my practice? How are those practice codes like working for me now, right? Am I getting reimbursed adequately and keeping the practice afloat? So you can both, sort of take the temperature of your patients and your own practice.